Ever wondered what types of colorectal cancer exist and how they differ from each other? Welcome to an exploration of colorectal carcinoma, a diverse type of cancer that originates in the colon or rectum. With a variety that's as complex as it is fascinating, colorectal carcinoma can be classified into several types based on an array of factors including histological features and molecular characteristics. So, buckle up for a captivating journey through the world of colorectal carcinomas. Stay tuned as we delve into the different types of colorectal carcinomas. First up, we have adenocarcinoma, the most common type of colorectal cancer. Adenocarcinoma is a bit of a big word, isn't it? But don't worry, we'll break it down for you. This type of cancer originates from the glandular cells. Now, you might be wondering, what are glandular cells? Well, these are the cells that line the inner surface of your colon and rectum. They're responsible for making and releasing fluids such as mucus. Now, when these cells start to grow out of control, that's when adenocarcinoma occurs. And this isn't a rare occurrence. In fact, it accounts for more than 95% of colorectal cancer cases. That's right, over 95%. So it's safe to say that if you're studying colorectal cancer, understanding adenocarcinoma is absolutely crucial. Now that we've covered the most common type, let's move on to some of the less common variants. While adenocarcinoma is the most common, other types of colorectal carcinomas exist. Let's delve into mucinous adenocarcinoma first. This type is distinguished by the presence of mucin, a gel-like substance within the tumor. This slimy characteristic often lends mucinous adenocarcinomas unique histological features. While the prognosis of this type may differ from the typical adenocarcinoma, it's the peculiarities that make it noteworthy. Next up is the Signet Ring Cell Carcinoma. Here, the cancer cells take on a distinctive appearance, resembling signet rings. These cells contain a large vacuole that pushes the nucleus to the periphery of the cell. Though less common, Signet Ring Cell Carcinoma often carries a poorer prognosis, making it a significant subtype to understand. Our third subtype, medullary carcinoma, is characterized by poorly differentiated cancer cells that follow a solid growth pattern. This variant is often associated with specific histological features and tends to occur more frequently in the right colon. Despite the ominous-sounding name, medullary carcinoma is an essential piece of the colorectal carcinoma puzzle. Then we have serrated adenocarcinoma, a type that develops from serrated polyps. As the name suggests, these adenocarcinomas have a serrated or sawtooth appearance under the microscope. They may also possess distinct molecular features that contribute to their unique standing in the colorectal carcinoma family. Finally, we come to carcinoid tumors. These rare tumors originate from neuroendocrine cells in the colon or rectum. They may be less aggressive than adenocarcinomas, but their rarity and unique origin make them a critical part of our discussion. These classifications are not set in stone. As research progresses and our understanding of colorectal cancer deepens, these classifications may evolve. It's also worth noting that individual cases may exhibit a combination of features, and treatment approaches can vary based on the specific characteristics of the tumor. Each of these types shows just how diverse colorectal carcinomas can be. Let's recap what we've learned about the different types of colorectal carcinomas. Adenocarcinoma, the most common type, originates in the glandular cells lining the colon and rectum. Mucinous adenocarcinoma, a subtype, is characterized by the presence of a slimy substance, mucin, within the tumor. The less common Signet Ring Cell Carcinoma is distinguished by cancer cells that resemble signet rings, and often comes with a poorer prognosis. Medullary carcinoma, characterized by poorly differentiated cells and a solid growth pattern, typically occurs more often in the right colon. Serrated adenocarcinomas, developing from serrated polyps, have distinct molecular features and a serrated appearance under the microscope. Lastly, the rare carcinoid tumors develop from neuroendocrine cells and are typically less aggressive. Remember, these classifications may evolve as our understanding of colorectal cancer improves through ongoing research. If you or someone you know is facing a colorectal cancer diagnosis, it's crucial to consult with healthcare professionals for personalized information and guidance.